We can debunk this myth in about 30 seconds. The late iconic Justice John Paul Stevens was confirmed by the Senate 19 days after this body formally received his nomination.
2 Republican senators have already said they'll vote against any nominee, but 2 more would need to do so for the process to fail. CNN's Caitlin Collins has more on this bitter political fight.
President Trump says he'll announce his pick to replace Justice Ruth Bader Ginsburg on the Supreme Court by the end of the week.
I think, in all due respect, we should wait till the services are over for Justice Ginsburg. And so we're looking probably at Friday or maybe Saturday.
Trump telling Fox News that he's waiting out of respect for RBG before baselessly claiming that her dying wish to be replaced by the next president, which she dictated to her granddaughter, was concocted by Democrats.
Well, I don't know that she said that, or was that written out by Adam Schiff and Schumer?
The president spent the weekend on the phone with staff, lawmakers, and advisors as he narrowed down his list of finalists to several women.
I'm looking at 5, probably 4, but I'm looking at 5 very seriously.
On that list right now are Amy Coney Barrett, Allison Jones Rushing, Kate Todd, and Barbara Lagoa, a Cuban-American judge from Florida that campaign officials believe could provide a political boost.
Well, she's excellent. She's Hispanic. I don't know her. Florida. We love Florida.
Trump making clear his desire to cement a 6-3 conservative majority on the court for generations to come.
These are the smartest people. These are the smartest young people. You know, you like to go young because they're there for a long time.
While it's not clear who he'll pick, it is clear that Trump wants to have his nominee confirmed before the November election.
I think the final vote should be taken, frankly, before the election. We have plenty of time for that.
Waiting until Friday to announce his pick would give Trump 39 days to get his nominee confirmed. On average, Senate confirmations for Supreme Court justices take around 70 days.
We should act quickly because we're going to have probably election things involved here, you know, because of the fake ballots that they'll be sending out.
The president providing no proof that fraudulent ballots are being sent out.
That report by Caitlin Collins, and just in the past couple of hours there have been reports that President Trump has already met with one of the top contenders on that list of 5. That's Amy Coney Barrett. She's currently a circuit court judge who would tick a lot of boxes for conservatives. She's a devout Catholic who is anti-abortion and believes in originalism, in that justices should interpret the words of the Constitution as its authors intended. For decades, top jobs in the Lebanese government have been dished out according to a power-sharing system. The aim is to keep followers of all religions happy, which is no easy feat given there are nearly 20 different sects in Lebanon. And it hasn't really worked. Even before the huge explosion in Beirut last month, there had been growing protests over corruption, government inefficiency and economic decline. Young protesters in particular blamed this power-sharing arrangement. Now, the relatively new president, Michel Aoun, has himself spoken of the difficulties he faces in forming a government. Here's the BBC's Sebastian Usher.
President Aoun has come across as a pretty detached figure during the crisis that's been enveloping Lebanon for months and months. He's aging, he doesn't seem that well, so not hugely engaged. What he said today is in the context of trying to form a new government. And essentially he was suggesting that the stalemate that's come, as happens so often with Lebanese governments, is due to the fact that certain groups are annoyed that they're not going to get what they usually do. This probably refers to Hezbollah and Amal, the 2 Shia parties, where the finance ministry has been under their control for a long, long time. And it could be that that won't happen this time.
Sebastian Usher discussing Lebanese politics there. Leaked documents show the owner of Chelsea Football Club in the UK's Premier League, Roman Abramovich, secretly owns stakes in players at other clubs. One of the players, Andre Carrillo, played against Chelsea in 2 2014 Champions League games. A spokesperson for the Russian billionaire insists the deals are lawful. The BBC's Richard Bilton has more.
This is the story of a football match. Chelsea against Sporting Lisbon in 2014. Secret files show Chelsea owner Roman Abramovich had a stake in not 11 but 12 players on the pitch. In 2016, a bank identified more than $1 billion of suspicious payments involving offshore shell companies owned by Roman Abramovich. This includes 4 payments made by Roman Abramovich companies in Cyprus. What's important is where Mr. Abramovich's cash ends up. Leiston Holdings in the British Virgin Islands got $156 million, and that is a controversial company.
The company was accused of being involved in the now banned practice of third-party ownership.
That report by the BBC's Richard Bilton. And finally, the French police, not long ago hailed as heroes after a series of terrorist attacks, are now facing growing criticism in the wake of the Gilets jaunes protests and the Black Lives Matter movement. Police representatives say public hostility is fueling psychological problems and suicides. One journalist spent 2 years undercover with the French police to investigate allegations of racism and violence. He spoke to the BBC's Lucy Williamson.
In the police, there's an omerta. There are no traitors in the police.
Valentin Gendreau has spent 2 years undercover as a policeman in the 19th district of Paris.
In the police station where I worked, 4, 5, maybe 6 policemen out of 32 were regularly violent. And the majority suffer from this racist and violent minority. But there are no traitors in the police clan. If you denounce someone, you become a traitor, and you risk being sidelined, intimidated and bullied. No one takes that risk.
Valentin has just published a book called Flic, or Cop, about life as a police officer. The allegations he makes are now being examined by the Paris police chief and internal police investigators.
One afternoon, we received a call to go to a building where a group of teenagers was playing music too loudly. We asked them to turn the music off, and they did. Then, 10 minutes later, a police officer hit one of the teenagers. The teenager was beaten up in the car and hit again when he arrived at the police station. He never tried to hit the policeman.
Loic Valder, a police union representative, says police violence is overstated, but that some of the tensions in tougher and more deprived areas are due to the police officers who work there.
The experienced policemen don't want to work there anymore, but young policemen are really looking for it. They joined the police, they watched so many movies. They want to do like in the movies, they want to catch thieves, so they choose those kind of areas.
During the Gilets jaunes protests here in 2018, videos allegedly showing police brutality against protesters went viral on social media, triggering a wave of criticism.
Lucy Williamson reporting there. And just briefly, Italians have voted to endorse a law that will slash the size of the country's parliament by more than a third at the next election. Nearly 70% have approved the measure in a referendum. It will see the number of MPs in the lower house reduced from 630 to 400. And that's World Watch for today. I'm Max Toll. Money?
Thanks, Max. Koina te purongo o te paututanga mo tēnei rā, Tuesday, September the 22nd. And that's it from us at Midday Report. We'll be back tomorrow with interviews and the latest news from Aotearoa and the world. But for now, from the team, kia pai tō koutou rā. Heia popo.
O kia ora koutou katoa, nā mo haere mai ki te manatu haora. Thank you for attending today's briefing. There are no new cases of COVID-19 to report in New Zealand today. There are 39 people now isolating at the Auckland quarantine facility from the community, and that includes 18 people who are positive tests and are cases of COVID-19, as well as a number of household members. 3 people are in hospital today with COVID-19, 1 each at Auckland City, Middlemore and North Shore hospitals, and all 3 are in isolation on a general ward. Since the 11th of August, our contact tracing team has now identified 4,003 close contacts associated with the cases over the last month and a half. And of these, 3,992 have been contacted and are self-isolating or have completed self-isolation. We are in the process of contacting the small number who haven't yet been contacted. There's one additionally reported case that is now considered recovered from COVID-19, so our total number of active cases is 61, and of those, 29 are imported cases identified in managed isolation, and 32 are community cases. And our total number of confirmed cases, of course, remains at 1,464. Yesterday, our labs processed 3,278 tests, bringing the total number of tests completed to date to 917,699 exactly. I should say that low number on a Monday is a typical pattern. It reflects the swabs taken on the Sunday, and we know our number of swabs on Saturday and Sunday tends to be lower than the rest of the week. It's worth reiterating here that even with the shifts in alert levels, both outside of Auckland, taking effect from midnight last night, to alert level 1, as in here in Wellington, and also when Auckland shifts down from 2.5 to 2 on Wednesday evening, it's important we all remain vigilant as the risk of COVID-19, although small, does remain. In particular, we all need to continue to monitor our health. Do not go out if any symptoms appear, and seek a test at that point. So I want to talk today about some test results that are coming through from time to time that indicate a historical infection. In these instances, the test result comes back positive, but with a high, what's called cycle threshold, or CT count, which is known as a weak positive result. Importantly, and I'll say this more than once, there is very good research internationally that shows such people with these positive results are not infectious. Now, sometimes these people seek a test because they have a respiratory illness, and it seems that an acute non-COVID respiratory illness then creates the conditions where if there's residual COVID-19 virus or viral fragments in someone's nasopharynx, then that is detected and does return a weak positive result. And over the last couple of months, we've seen 4 different types of examples of this. First, there have been people who have travelled from New Zealand and who have returned a positive PCR test on arrival in another country. We have reported a number of these, one, for example, identified in Japan, another in South Korea, and there have been a few other instances. On further follow-up, it's apparent that these people were not acutely infectious or infected, and they were not recently infectious before leaving New Zealand. So that's the first group. The second group are people who arrive in New Zealand and who return a positive test in managed isolation, or subsequent to leaving managed isolation after testing negative during their period there, but they don't have acute symptoms. The third group of people are who have been in New Zealand throughout the pandemic and who return a positive PCR result and who had a documented infection earlier in the year and are already in our case count. So they've sort of got this, they're already classified as a case, and they've got another positive test that shows up sometime several months later. And finally, there is a fourth group of people who have been in New Zealand throughout the pandemic, who return a positive PCR result, and who do not have a documented infection from earlier in the year, so they're not in our case count. These people have a clear history, though, once they are spoken with, of a previous acute illness consistent with COVID-19, but they were not tested at the time. And follow-up serology confirms that they, and possibly other members of their family, have been infected in the past with COVID-19, but didn't get tested when they had an acute infection and are therefore not part of our case numbers. So in all of these cases, the test result is often a weak positive, and the CT value, which is usually high, so over 30, suggests that the infection is an old one. So we're in the process of developing a protocol and setting up an expert panel to help with standardising the way these cases are both managed and also reported. In particular, the panel and protocol will help ensure a consistent approach to cases that are effectively borderline cases and that are being further investigated. So the panel will assess individuals returning a weak PCR test with a high CT value to determine whether just to confirm that the infection is historical or recent, and to guide subsequent public health measures, especially regarding contact tracing and management, and any steps that might be needed to limit risk to the community. Some of these historic cases under investigation will be included in our future reporting, and where we conclude that they have not been infected with, that they have definitely been infected with COVID-19, but are not in our case numbers here or counted as a case in a country they have travelled from, then we will add them to our total number of either confirmed or probable cases, depending which category they sit in. And finally, just to reiterate again, before I give an update on the Auckland flight, these historical cases are not infectious. It appears there are viral fragments still in their nasopharynx, and that sometimes they can return a positive test. So an update now on the case of the man who left managed isolation in Christchurch, having returned negative tests for COVID-19 while in managed isolation, then tested positive when he became symptomatic in Auckland. Our national contact tracing team has recorded 85 close contacts from the charter flight from Christchurch to Auckland, and of those, so far 29 have been tested. Those are all the people who were closest to him on the plane, so the front 9 rows of the plane, he was in the 4th row. They've all but one returned a negative test, and the remaining person returned a positive test with a high CT value yesterday. As I've discussed, that high CT value suggests an old infection. Now, this person, who has had no symptoms since arriving in New Zealand, was retested and returned a negative test this morning. And serology testing is also being undertaken. If the serology is positive, that would confirm that this person has had an old infection and they have had a time to develop antibodies to COVID-19. This person also has already returned negative day 3 and day 12 tests while in managed isolation, and as I said, had no symptoms throughout their time in New Zealand. We consider the person still under investigation as an historic case, and we are confirming whether or not the case was reported in India, where the person travelled from to New Zealand. Meanwhile, we are taking a precautionary approach, and the person has been transferred to the Auckland quarantine facility. And as I said, the remaining people on that flight who weren't closest to the person, just out of an abundance of caution, are being contacted and will be tested as appropriate. And before I finish, I do just want to take a moment to acknowledge all the people, several thousand, who are working in our managed isolation and quarantine facilities. They are on the front line of our efforts against COVID-19, putting themselves between the rest of us and the virus. And every day these workers ensure that returning New Zealanders are well looked after while they complete managed isolation or quarantine, and the rest of us are protected from cases being imported into our communities. So I want to pass on mine and our collective thanks to all those workers for the vital role they are playing as part of our response. I'm happy to take questions.
Would you be comfortable with offering shorter stays in managed isolation to people who are coming from COVID-free countries?
I think you're referring to a policy statement that's just been made by the National Party, and what I would say is that this is the time of in the 3-year triennium when parties are putting out manifestos and policy statements, and I don't think it's appropriate for me to comment on any party's policy positions as it relates to COVID or any other matter.
Did the person, sorry, just to clarify, he tested positive and then was retested this morning and
Yes,
tested negative?
that's right.
Can that person be genome sequenced?
Yes, so if possible from the sample yesterday, this can be one of the challenges with these viral fragments, that there may not be a complete segment of the RNA from the virus. But what ESR are now able to do is match the parts of the RNA that they do have to see if it matches other samples we already have. So we will be looking to see if we can do that. Yes.
With the Ministry's latest testing plan, are you making it clear to workers in hospitality, tourism and transport that work is being done to make more testing available in their area, with school holidays coming up, Auckland is travelling, all that sort of thing?
Yes, that's important. So the key thing about the testing plan, and actually it's the same testing plan we've had for the last 2 weeks, is anyone, anywhere in the country with symptoms should be tested. And secondly, as part of our surveillance testing, we are wanting to focus on people who may come in contact with Aucklanders travelling around the country, and as you say, particularly with the school holidays coming up. So we've identified those working in service industries, travel industry and tourism, and we've asked the district health boards to make available specific opportunities for those people to be tested so that they know where they can be tested and the testing is taken to them. And this is testing even though they don't have symptoms, so it's surveillance testing.
Can you be a bit more specific about what you mean by making available? Ministry of Health officials like go into cafes or work out which one should be gone to and then kind of target them proactively, or they expect people to come to them?
So we've asked the district health boards to, they're very good in terms of what they need to do on the ground, so they would make mobile testing sites available. So if you're thinking about somewhere like Queenstown, somewhere right in the middle of the city, there where service workers were able to go, and or at the airport. In fact, I know towards the end of last week they had a specific initiative at the airport to pick up all the airport workers, and of course publicity and working with the employers to free up people to be tested as well.
With the really positive stuff, I mean, does this change anything, any strategies, for instance, I'm thinking at the border with testing or anything like that?
It doesn't change our strategy per se. However, I guess we're at the position now where we are doing more testing, and it seems that we're seeing just a few more of these, both onshore New Zealanders who might have been infected. There's no doubt that during that period of March, April, when we went into alert level 4, that there was other infection in the community that wasn't identified and reported then, but because we broke the chain of transmission, it didn't continue to spread. And so we will have seen, and we will see a handful of these. If they haven't been previously identified as a case, then we will report them, because that's our obligation to the World Health Organisation.
And what do you think about testing outside once you've managed isolation?
Yeah, this is something we are looking at, as we flagged yesterday, especially given this case of the person who travelled from India. And even then, it's who might we test and at what point. And I've asked the team to do some work on this, to look at the evidence from around the world, to see if there is a group of people who you might want to do a further test on once they've left isolation.
Is there any sort of possibility that the India strain is associated with like a long incubation period, given there's been 2 people with the same sort of long incubation period?
You mean of these sort of historical cases that I've talked about? Or are you... Yes.
Yeah, and also just the strain from India itself, could that potentially be associated with having a long,
Oh, I see. Okay. Yes, so the person who we reported on Saturday, who had gone right through managed isolation with negative tests, yes, one of the things we are looking at is not just where they might have got infected, but also it seems likely, particularly if that was on the flight from India through Fiji to New Zealand, that it was a particularly long incubation period. Now, it's not unheard of, but it's rare for that incubation period to be beyond 14 days. And that's one of the things that we're considering in terms of whether there should be follow-up testing for people who either have come from a country where there is a higher risk a priori that they might have an infection, or who were on a flight where we subsequently identify cases. For example, could be 2 groups we might consider as for further testing. In terms of this issue of whether we've had infection sort of laying around in the community here in New Zealand, I think we've ruled that out as being the source of the Auckland outbreak. And again, what we've seen though is one or two of these historic cases from New Zealand, people who have never travelled out of New Zealand, but who were either identified earlier in the year or not, that actually it's several months later that they are testing weekly positive, but they're not infectious.
Dr. Bloomfield, how strict is the criteria to get an exemption in managed isolation to see a dying relative?
Well, every application is assessed, and MB does this process, is assessed on its merits. And obviously the first priority is to ensure that the risk to the public and indeed to other family members is minimised to the greatest extent possible. I can't comment on, I guess, subjectively on whether it's strict or not, but I do know that the criteria are applied very carefully and consistently to each case.
New South has spoken to a man in isolation. His father has less than 24 hours to live. He's waited all weekend for his exemption, but then was declined.
Yes.
Is this fair?
Well, I think you should follow that up with MB, because they are the ones who are in charge of that process. So that's a question to be put to them.
Do you know the numbers of people who have been denied exemptions?
No, I don't. That's something that MB will be able to tell you, though. Please.
With regards to the sliding down alert levels, Are you concerned that we now no longer have mask use being mandatory, particularly everywhere else other than Auckland, given that those behaviours for wearing masks have just started to become entrenched? And are you concerned that maybe if we have to go up again in alert levels that there'll be resistance to that?
So I think 2 or 3 things there. First of all, the masks are of most value where there is community spread, there's no doubt about that. Secondly, we are continuing to encourage people, even in alert level 1 around the country, to use masks where they have been using them, including on public transport, and I think people have got used to doing that. I will continue to be using one when I take public transport, and my understanding is that Air New Zealand is also still requiring people to use them on flights and making them available for people. And I think it's good if people do continue to use them in those settings, even in alert level 1. As you've said, this is something that is going to be part of our ongoing and future response to COVID-19. So the more we can sort of get used to wearing masks in certain settings, I think. So saying, what New Zealanders have shown over the last 2 weeks is they will rapidly adopt this behaviour if there's a requirement, and also if they see that there's a purpose and value to it.
Did you make that recommendation when you were giving your advice to Cabinet about what they should do with these alert levels, with that retaining masks was important?
My advice was that we should continue to encourage their use in public transport and on domestic flights, even under alert level 1, and that was certainly the messaging that both the Prime Minister and I gave yesterday.
But you didn't want that mandated?
I didn't think that at this point there is an impetus to mandate that. However, we've seen that if we do have to move up to alert level 2, that there is already a precedent now for their mandatory use in those settings.
The Prime Minister said you asked for events to be limited to 500 people, even at level 1. How do you feel about Cabinet's decision not to implement that recommendation?
So the advice I gave to Cabinet was that because Auckland's still at alert level 2 with a maximum gathering size at 100, whereas outside of Auckland from today there's no maximum, Cabinet might want to consider a maximum limit on indoor gatherings only, because that's where there's a higher risk in those closed spaces where there's close contact and a lot of people. For larger gatherings. In fact, what Cabinet decided was to take a different approach to that, which was to identify all those gatherings that might be there over the next couple of weeks and talk with the organisers about putting in place measures that would help to mitigate that risk, including physical distancing, use of the app, and also keeping a record of seating plans, so we knew where people were seated should we need to follow them up.
Are you comfortable with the government's approach on that front?
I think it was good because it addresses the potential risk that I had identified. The other thing to point out is that if there are these large events, indoor events outside of Auckland, there's almost certainly, for example, if we think of a music concert, there's almost certainly an opportunity for Aucklanders to attend those in Auckland. They're unlikely to be travelling, for example, to a Bene concert outside of Auckland.
So you didn't recommend to Cabinet to have 500-person limit?
No, I said it was something they could consider, and here was the issue, and they decided to address that issue in another way.
We saw Auckland go to that 2.5 level. Would you think that we could see a 1.5 level specifically for Auckland?
I don't. I think we're sort of at this point done with the 0.5s, and I think the aim is to, all going well over this next couple of weeks, to bring Auckland down to alert level 1 along with the rest of the country. So saying, our alert level 1 now is different from what it was last time. You know, we've got QR codes around the place. People are using the app. We're still encouraging mask use in public transport and on flights. I think there's a much higher level of vigilance, and we'll be obviously wanting to keep the testing rates up high as well.
And just sorry, quickly on the weak positives again, can you just quantify how many weak positives we've already had, and are they part of our tally already, or
Yes.
are they a separate group that you're considering to be part of the tally?
None of them are part of our tally. Obviously, the ones that are detected when people travel overseas, it's up to those countries to determine whether they are part of the tally. The other ones, some of them we've detected and managed isolation, quarantine, and then we just, if they have a positive test there, then we do include them in our tally. And there's been a handful that we've had onshore of people and who have not travelled overseas but who have been infected. Either we know about it or we haven't known about it. So we're just wanting to formalise the way they are reported to make sure we're consistent.
And so you had that one from the flight which you talked about today, so
Yes.
how recent are those other handful ones?
Actually, the first one was in Queenstown, and I have talked about it. There was even, I think, 6 weeks ago, a fellow who was known to have been a case back in March, then represented with an acute respiratory infection, tested positive, but actually there was subsequently another explanation for his symptoms, and the positive test was sort of, again, a historical reflection of historical infection. Yes.
And I appreciate this will be a difficult question for you to answer, but I'm going to ask it anyway.
I'm not used to those here. Yeah.
There's obviously been a bit of talk recently about whether there's been any political influence and the fact that we're now approaching an election and that has whether that has influenced the decision to slide down alert levels or maintain alert levels. What is your position on this, and do you believe that there has been any kind of influence at all on that front?
Well, what I can talk about is my advice, and what I can say categorically is there's no political influence on my advice. I'm a public servant, and so the process is that I develop my advice here and send it across to the Minister. It is then included and informs the Cabinet paper, which then goes to Cabinet to make a decision on. And as you'll have seen, it's been highlighted here today, Cabinet doesn't always take my advice. So I can categorically say that the advice I give is objective and it is informed by our own assessment of the actual situation and any emerging evidence, and I usually triangulate the advice with my Chief Science Advisor and others, and there are plenty of other science and other experts in the community who are providing me with advice as well.
Last week you talked about going to a level 1 plus, but that wasn't in your recommendation on Monday. Did anything change in particular with that?
Well, it was in my recommendations. There were two features of my recommendations. One was to continue to strongly encourage the use of masks in public transport and on domestic flights, which is what I would call a plus, what we had previously. And also I did give the recommendation about considering the maximum indoor gathering size of 500. So there are measures in place. So I would say those are additional to what the pure alert level 1 might look like. So that's, I guess, is a 1 plus, but it's not a 1.5. I didn't want to quantify it.
Would you recommend concert goers wearing masks to concerts that have over 500 people attending?
They may want to do so, yes.
Where did the long incubation case go in Auckland during the 5 days after leaving isolation and him becoming symptomatic?
Yes,
Do you know?
not very far. And in particular in the 48-hour period before he became symptomatic. I don't have the details, but the public health unit up there has assessed the places where the person has been to determine if there's any risk or if anyone needs to be notified. I should say that they usually go back and re-interview people, and they will do in this case, and it may be that does elicit other places where the person's been, but I do know that he hadn't gone very far out and about in the preceding 2 or 3 days.
Johnny Bloomfield, on the yachties in the Pacific that have asked to come over here, there was some reporting on the weekend saying that they've received advice that they're not allowed to come. In that advice is wording along the lines of case-by-case basis for humanitarian reasons. You know, they told our reporters that they can't do it in a case-by-case basis because they need to know whether they're going to be allowed in here. They can't go home, it's far too late for that. And they can't be in the water when cyclone season starts. So they're kind of sitting ducks out there and they're getting quite desperate. Are you comfortable with the advice that means that there's 300 odd yachties with more than that number of people are going to be out there come cyclone season?
Yes, I'm happy to provide. I'm happy with our advice, and I'm happy to provide some clarity on that advice. First of all, the case-by-case basis is if there is a situation where a yacht is in distress and needs to be, and there's a sort of a humanitarian reason for that yacht to seek safe harbour in New Zealand. And of course, those will be assessed on a case-by-case basis. What was being requested was that quite a large number of yachts are able to sail ahead of the cyclone season to moor up in New Zealand for the period. Now, these are not New Zealand citizens. Of course, any New Zealand citizen can sail their yacht back to New Zealand and do so. We did not feel that there was a strong humanitarian reason, just the possibility of a cyclone where they are currently moored up in the Pacific. And the main issue that just because their vessel would be uninsured if it was damaged in a cyclone does not in itself constitute a humanitarian reason why we should open our border to these yachties. And as part of that advice, we also said that there is nothing preventing them before the cyclone season from sailing back to their home country, nor would there have been anything preventing them from doing so in the 6 or 7 months that we've already had the pandemic present around the globe.
I mean, I appreciate that, but I think for them, they were hoping or assuming that they would be allowed it, and now time has essentially run out. I mean, there were, I lost count of how many cyclones that went through that area in the last season. I think it was 3, could have been 4. They're devastating events. I mean, the government is essentially saying that our Pacific neighbours who are much less resourced than us, you take care of them, basically, because there's nowhere else for them to go.
Yes, just to reiterate the point you made, they had hoped that that permission would be given and perhaps expected, but that wasn't the advice, and we worked very carefully and closely on that with Immigration New Zealand and our customs colleagues as well.
In terms of the people who are in hospital, I just want to ask, there are only 3 people left in hospital, but over the course of the Auckland cluster, there's actually been quite a few. It's not an insignificant number, and some have gone in fairly rough shape. I'm thinking about that guy in North Shore Hospital who nearly immediately went to the ICU. Have you been keeping tabs at all on what's happening to people after they get released, like what shape they're in and whether some of them are having some of these issues we've seen around the world with very long and tough recovery times?
We haven't as a ministry, and normally that follow-up would be clinical follow-up done by either the clinicians who looked after them while in hospital or the general practitioner. I would have to check if there's any formal follow-up happening. I do know clinicians are often very keen to do this sort of follow-up and then publish what their findings are for people that do have residual symptoms. And actually, I did have an email during the week from someone who was one of our cases earlier in the year who has had residual symptoms and sort of after effects of COVID infection, and that person has started up a little bit of a support group and has found quite a number of people. So it may well be that there's an opportunity for some research on that group. We do know there is, as with any viral infections, people who have residual symptoms, either respiratory or fatigue and ongoing sort of things, and that's why we have this term post-viral syndrome with a very well documented series of symptoms that can take quite some time to recover from.
Do you see a value in communicating those stories to the public? Just because often you'll stand there and we'll also then just report that, oh, we've gone from 4 to 3. The number in hospital has gone down, and people assume these people have recovered, but often, even if they're not in a hospital, they still have debilitating symptoms.
Quite, and it may be that the people with ongoing symptoms were never hospitalised, may have been able to just take care of themselves at home or being cared for by family members. So it is a good suggestion.
The week positive who tested negative this morning, you said that they had also been through MIQ and tested negative?
That's correct, twice, and has not been symptomatic at all, and actually was quite shocked to return the positive result, having had no symptoms through their period here, their time in New Zealand.
MIQ, and is the working hypothesis that they caught it before they came to New Zealand?
Yes, the latter would be the working hypothesis, and they were on that same flight from Christchurch to Auckland on the 11th of September, so they left MIQ on the 11th of September, so over 10 days ago.
What can we learn about the origins of reported COVID cases, and how is this information useful?
What can we learn? Well, the genomics, the whole genome sequencing we've been using has been very helpful in us characterising this outbreak in Auckland and also identifying if cases are associated with that outbreak or not. And likewise, we can then track back to look at the genome sequences that other countries are reporting. And what we do know is that, for example, with the Auckland outbreak, the B111 clade, as it's called, is one that originates most commonly out of Europe and especially the UK. And so that gives us, first of all, it provided a clue as to which cases in managed isolation we should do the whole genome sequencing on first to see if there was a match with the clade for this community outbreak. So it's very helpful in terms of us working out where an infection might have been introduced from if one comes into New Zealand.
And at which point did we start in New Zealand genomic testing? And I understand that obviously in the early stage of the pandemic we weren't keeping a lot of those samples, they were being taken and then they were being destroyed.
Yes.
So when did you start retaining them and doing genomic sequencing as a matter of course?
So the samples are not destroyed, they're all kept, and the challenge has been, I should say though that ESR has genotyped over 50% of the total number of cases we've had in New Zealand, which is actually a very high proportion if you look globally. And they've also been able to test around 86% of the samples from the Auckland outbreak, and were able to get on 76% a sample that they could do the actual sequencing on. It's been a great addition to our overall response in this Auckland outbreak, but ESR continue to do testing, genome testing on all those samples where there is a high quality enough sample. However, one of the things that we do want to do from here, and we've had a quick review done of this for this outbreak, is make sure that those samples that are collected, any positive sample, is stored and is sent for whole genome sequencing straight away, and the sample is stored in such a way that we are most likely to get a result from that whole genome sequencing. So it will be a very important part of our efforts going forward. Last couple of questions, perhaps.
On the measles report that came out last week, my colleagues at RNZ Pacific are wanting to know, they've been speaking to GPs who have seen decline in the measles vaccination pickup rate, and whether or not that you've noticed that internally and any efforts you're making to pick them up.
Thanks. Yes, we have seen a slight drop in the 3 months to the end of June in child immunisation rates, and including for MMR, reflecting the sort of the period during the alert level 4 and 3 earlier in the year where children were not going out to be immunised. So we've given a very clear message to DHBs that this needs to be a priority. Of course, we need to get those MMR vaccination rates up again in children. And from the 1st of October, there's a change so that those 2 MMR vaccines are given at 12 months of age and 15 months of age. Previously it was 15 months and then 4 years. So we're bringing them forward, and we're also just starting to roll out the wider immunisation campaign to vaccinate the 15 to 30-year-olds where we know there are historically lower vaccination rates for MMR.
GPs are concerned once kids kind of drop off the radar, and it's really hard to get them back into the system. How concerning is that for you?
Well, it's concerning, of course, because it's really important. We do not want another measles outbreak. So saying, we have in New Zealand been able to get to high levels of MMR coverage, around 90 to 93% around much of the country and across most of our ethnic groups a few years ago, and we really need to redouble our efforts to do that again, using a whole range of methods, including, where appropriate, vaccinating children with permission of parents in their homes if that's the best place for them to be vaccinated.
One final question. You talk about a slight drop over the lockdown periods. Do you know, is it in single digits or?
Yes, it's I think 2 or 3%. Yes.
One final question, and with regards to the Auckland index case, can you provide an update on whether you've been able to narrow down where that person may have initially picked up the virus?
Nothing further to say on that, unfortunately. However, ESR does continue to do the whole genome sequencing on all the samples from people who have tested positive in managed isolation. As of 2 days ago, there was, that I recall, it was 65 they had been able to get samples from, and not all of those, I think 49 they had been able to sequence, and they're continuing to do those. And it may well be that that will provide a clue, but at this stage no further light to shed on that. Thank you very much. Appreciate you coming today.